Crizotinib works very well for patients with non-small cell lung cancer patients that have a rearrangement of the EML4 ALK. Since the ALK kinase is active, this crizotinib inhibitor is very effective. However, at some point, the tumor gets resistance against the treatment, and you really can't know when it occurs. The only way is looking at the radiological imaging to see when the tumor starts to grow again.
Right, so basically you need to select patients who are ALK positive and then treat them, but then you also need to monitor them.
Yeah, so that's the monitoring thing that we have worked with to find in the circulation, in the platelet fraction, we can find back the EML4 ALK. If it's present, it comes from the tumor, and we can use that for predicting the outcome of the treatment with crizotinib. And we can also follow it over time and see when the tumor recurs, even before you can see it on the imaging.
Now, could you tell me all about platelets and why you've been looking at platelets?
Platelets are interesting. We think they are, yes, they're doing with wound healing and clot formation, but actually they are very, very good at sequestering material during their circulation. We know that they are interacting with the tumor. And for example, with CTCs, when they form daughter tumors, the platelets is important when they exit the bloodstream into the tissue again. Liquid biopsies, if you are around here at this conference, you hear it here and there, and it's kind of a growing field now. And so the tumor, during their life, they secrete material that is ending up in the circulation. We take advantage of the ability of the platelets to sequester material. So we take out the platelets from the circulation and we question them, do they contain ALK transcripts or not?
Could you tell me about the study that you've done, what you achieved in fact?
So what we have done is we compared 3 different biosources, blood-based biosources. So we looked at the blood, we extracted the platelet fraction. Also, you have heard about the exosomes, so we took the exosome fraction. And you also took just what's left of it, the plasma, the platelet-depleted plasma. And we looked for this rearrangement in those 3 different fractions. And we had a high sensitivity compared to the other 2 when we looked at platelets.
And you've done this in patients with non-small cell lung cancer?
Yes, with a tissue status that is positive for the arrangement. Clinically, at the moment we can't really implement it now. What we could do is that we can detect, we can predict the outcome of crizotinib treatment, and also we can see when we have resistance that's occurring in the patient.
So what
this is potentially now, since we really need to verify these findings. This is a pilot study, so cautious. It gives us the opportunity to switch therapy. So we have 2nd generation ALK inhibitors. So if crizotinib fail, we could put it at an earlier stage. We can put them on a 2nd generation ALK inhibitor, and thereby have a higher chance of response to the treatment.